Though, something very important to talk about with Dana.
Really is, John. Thank you. Thursday, October 10th, is World Mental Health Day, a day the World Health Organization urges action and conversations to raise awareness about mental health issues and suicide prevention. This is not always something that is comfortable to talk about, but it is essential. My guest today is Bob Gebbia. He is the CEO of the American Foundation for Suicide Prevention here in New York, but it certainly is an organization that helps everybody in the country. Thank you for being here.
Oh, my pleasure.
This is such an important time. It always is. Tell us your thoughts as you address these concerns.
Well, it's really important to understand that suicide is a major public health problem in our country and worldwide, and we finally are starting to see action to try to address that. And it's important because we lose in the U.S. alone 47,000 people every year to suicide, but it's a preventable cause of death. There's something we can do about it.
One of the things, World Mental Health Day, and Bob, the World Health Organization saying every 40 seconds, someone in the world dies by suicide.
Yes. That just highlights the extent of the problem. And I love the fact that this year, for World Mental Health Day, they've adopted suicide prevention as a theme and saying, you know, take 40 seconds and do something. You could learn the warning signs and risk factors. You can reach out to someone, a family member or a friend who you think may be struggling, and have an open conversation with them about it. You can get involved as an advocate. You can do things to help this cause. Even if you haven't been personally affected, get involved in it. It's important.
Be a better listener.
Better listener, for sure.
Be a better contribute in some way, financially, but in person is so very important.
Yes.
Let's talk about warning signs.
Yeah. So, you know, if you see changes in behavior of a loved one, you know, they're sleeping too much, sleeping too little, perhaps they're isolating themselves from their friends, from their family, you know, from the things they like to do. If they're using alcohol and drugs, you know, and increasing that use in a way that's really worrisome, those are things to take seriously. And also, if they're talking about this, you know, people will often say things like, I don't want to live anymore. I'm a burden.
What do you do? What do you do, Bob?
Well, it's important to listen to those things, both what they say and how they're behaving, and approach them. Have an open, honest conversation about it. It's okay to talk about this. People think if you talk about it, somehow it's going to make it happen. That's not true, and it actually can prevent it from happening. They may open up, but you got to be a good listener, as you said, and you got to take it seriously. And if you see something you don't think is right, encourage them to get help. Seek the help of a mental health professional, of their primary care doctor. Somehow get them in front of a professional that can assess it and help.
One of the things that is so important, seeing somebody for your mental health is not a bad thing. Don't be embarrassed about that. It's important to reach out for help.
It's a sign of strength. You know, you look at what's happened in our military for years, you know, look at the problem with suicide among military and veterans. And that message is changing from just be tough to it's okay to ask for help. You'll get better. It's the brave thing to do.
The graphics that we've been showing, which are from the foundation, and well, they're called shareables.
Yes.
So one of the things you can do in your 40 seconds is share these, post these. They're upbeat. Talk about them. How it's such a neat approach.
Again, we want to be hopeful about this, because if we act, we can save lives, and that's hope, right? And encourage people to get help to recover. So these shareables are about hopefulness. They're about doing something. And it's so easy on social media today to get this message out. Get them to your friends, your network of friends and family.
I like recovery is a process. Give it time. And I love that the character, the woman there, she's appears to be doing yoga, which is something you breathe and you give time.
Yes.
No one is super all the time, super mom, super dad. No, you can't be.
And we all have mental health. And when it's not good,
we have
to do something about it.
We do have it. Well, what about the government? What's the government doing?
Well, I think that's an important part of what we're all about now at our foundation, and that is to advocate for increased federal funding, for sure, into things like research. We don't have enough science. We need more to know what to do to prevent suicide. That means investing in the research. That's helped every other public health problem. The more we know, right, from science, the better we are at prevention. That's one thing. Two, crisis services are underfunded in our country. we need to have a bigger investment in the safety net, in the crisis services available to people who are struggling. And then more programs, you know, through our federal agencies. This is a major cause of death.
10th leading?
10th leading cause, and yet the investment pales compared to other leading causes of death. So we need to step up the advocacy to get our federal government to respond.
And we've seen how it works with breast cancer, with lung cancer. It can happen.
It makes a difference.
And it can save lives. Thank you so much for joining us, Bob Gebbia.
My pleasure. Thank
the
you.
CEO of the American Foundation for Suicide Prevention. Everything you said so important, and we'll keep that with us. Also very important for us to say, if you know someone who is talking about suicide, or you see the symptoms and that person needs help and you need help helping that person, the National Suicide Prevention Lifeline, 1-800-273-TALK, 1-800-273-TALK, which is 8255.